Alrighty, everyone. Well, it is just about 4:30, so we will start to get ready for tonight's summit. Thank you so much for everyone for joining in. My name is Sonia. I'll be your moderator for this evening for the Level Up to Summit that is hosted by Pharm PH, LLC. Just a couple of brief reminders for this evening. We do not have a live comment section for tonight's stream. So if throughout some of the interviews that we do see this evening, if you have a couple of questions as you're watching along throughout the summit, please be sure you write them down and keep them on hand. There will be a live Q&A session on Friday where you'll be able to ask those questions to our host, who I will introduce in just a couple of moments. As well as you could visit CourseCraft. That is the actual website that you went to register for the summit. You could post your questions and your comments there, and within hopefully a couple of days, you should get a response back. So just as a general reminder, we will not have comments available for the live summit tonight. But without much further ado, it is my honor and pleasure to introduce Dr. Chinela Anwanwu. She is our host for tonight's summit. In just a brief moment, we'll have a small little intro, and then she will come on, tell you a little bit about what you can expect within your next 3 days here at the Level Up to Summit, as well as introduce your speakers for this evening. So enjoy, everyone.
Hi, I'm Dr. Chinelo Enwanwo, Director and Founder of Pharm PH. Hello, everyone, and welcome to Pharm PH Virtual Summit, Level Up to Health Coach Summit. I'm thankful for everyone who's helped put this together. And I just wanted to kick off today by introducing a few of the speakers that we will have this evening. And for those who didn't tune in to hear the moderator speak, the summit is actually recorded or has been recorded. So it was great doing those interviews in this pandemic. It's wonderful to be able to share some of the interviews with you, and hence the reason why we're doing this summit. And so, as mentioned earlier, there will not be a comment section because it is, we're just broadcasting live today. But the speakers we have for you this evening, the renowned Margaret Moore, and she has great tips to share about health coaching. I hope you guys will tune in. And then followed by an interview with Zikea McCurdie, who happens to be one of the instructors that we have here at Pharm PH. And she'll talk about her experience as a health coach, how she got started, and getting board certified as a health coach. Very interesting, and hope you guys will tune into that. Last but not the least, for tonight's speakers, we will have Suzanne Lineberry. She is a certified health education specialist, master certified health education specialist, and has tons of information and experience to share about health coaching. And so I'll just let you guys, sit back, relax, and take notes, take questions. If you have any questions at all, feel free to send us an email at the email address posted on the registration page. And again, for just a couple of other notes, the summit will also air live tomorrow at 7:30 p.m. Eastern Standard Time, as well as Friday, 7:30 p.m. as well. We have different speakers lined up for both days. Really great, informative sessions, and I hope you guys will enjoy too. And so this is Black History Month. February is Black History Month, and we have a nice special coming up for you guys just to celebrate the month. And last but not the least, regarding CE credits. So this summit has been accredited and approved by the National Commission for Health Education Credentialing, that is NCHEC, for up to 4 CE credits for those who are CHES, MCHES certified. It's also approved for those who are certified in public health, as well as nationally board certified by National Board of Health and Wellness Coaches. So this activity will be available for credits. And if you go to the course registration page, you will see the details on how to obtain your CE credits. There are 2 parts to obtaining the CE credits, so just make sure to follow directions and get the appropriate credits. And so we'll get started and hope you guys enjoy the sessions. Thank you. All right, so for this session, I have a very special guest on board with us, Miss Margaret Moore. She is the founder of Well Coaches Corporation, also the co-founder and co-director of the Institute of Coaching at McLean Hospital, which is an affiliate of Harvard Medical School. She is also the co-founder of the National Board of Health and Wellness Coaching, and she's authored many books in the field. We are very glad to have her doing this interview with us. And without much ado, I'll turn it over to Ms. Moore to get started and tell us a little bit about herself.
Hello, and thank you so much for inviting me to have this conversation today. So, in the simplest terms, I'm a coaching geek. And I mean that in every sense of the word. So my first career was in biotechnology. Mm-hmm. I'm actually a biologist with an MBA.
Oh, nice.
I was very focused on developing new medicines and vaccines for human health, and reached a point just over 20 years ago when I said, we need more inventions for human health, but we are not doing so well in supporting people to take better care of their own health and well-being. So as I thought about where to focus the next phase of my career, I had a dream. And we're recording this on Martin Luther King Day, and so I'm very aware of the power of having a dream, but no map, right? The dream, but no map. But my dream was that we would create a new professional in healthcare who is the expert in helping people make sustainable change and get healthy and live their best lives. And so when I started out in 2000, I quickly realized that there was not a coaching curriculum suitable for health professionals, because at that point, the coaching industry was led by life coaches in the United States, and some leadership and executive coaches as well, who had not done the shopping around for the theories that supported the coaching model. And so I kind of started from scratch. I met with Jim Prochaska, who developed the transtheoretical model. I got to know the motivational interviewing group, and on and on and on. I went to all the early positive psychology conferences. I basically started from scratch, put a team together. All of that, which is now written up in the coaching psychology manual. So that got started in 2000. It took 8 years before we were ready to publish that manual. There were a dozen of us working on that. And what we did is first I would coach people, figure out what I was doing, go to the literature, figure out what supported what I was doing. We created a program, we trained a bunch of coaches, and then we tested the outcomes of the coaching protocol before we even launched the school. So we were pretty sure that the protocol we built right in the early days was science-based, but also could deliver outcomes, positive outcomes. And now there are a dozen peer-reviewed studies of the outcomes, positive outcomes of the Well Coaches protocol. And then, of course, there's an entire literature base for the field. So we really believed early on that coaching needed to have a scientific foundation, and that ultimately you needed to study the outcomes of the protocol, which was an integration of lots of pieces of science.
Okay, that's fantastic. And I remember before my pharmacy years, I was in public health. And at the time I was going to school, that's when I was seeing stuff about health coaching, but my mind really wasn't that area at the time. but I would see like the well coaches pop up because I'm a chess
Yeah.
before I went to pharmacy school. So I was keeping up with my chess activities and things of that nature. And now it's like fast forward, like you said, 20 years,
Yeah.
20 years later, it's a whole different ball game.
Yeah.
And so I know you've been doing some work with the standardization around the coaching field and profession, if you will. Can you talk to us a little bit more about the impact of certifications or credentialing and the, what it has to, how it can impact the field in the future?
Yeah. So let me start by saying that 10 years ago, there was a small group of us that were training health and wellness coaches. And we all got together and agreed that for the greater good, we would develop standards that were, even though we were competitors in the marketplace, that it would be better for the field, for coaches, and for the future of coaching if we all aligned. It took us about 5 years to create the training and education standards, many conversations over many years to be a good base. And then when it came time to build a test, a certification exam, we were fortunately introduced to the National Board of Medical Examiners, which has been responsible for the physician licensing examinations in 1915. And so they're particularly skilled, very prestigious processes to build a robust exam. So we joined forces with them. In fact, we created what is now an affiliate of the National Board of Medical Examiners called the National Board for Health and Wellness Coaching. And that group in 2016 operationalized the standards. So we approve coach training and education programs that meet the standard. And then the graduates of those programs are eligible to complete the National Board certification for health and wellness coaches. And then there were about 15 of us who sat in rooms for days and days and days for 2 years, writing 600 examination items. I don't know if you've ever been involved in writing questions. Negotiating every single one all around the table.
Oh, okay.
Because we all have different perspectives, and so we really, as a field, really came together to agree. And the examination is robust in terms of NBME's experience, and they lead many examinations in the field, not just health and wellness coaching, things like veterinary licensing, and they did obesity medicine, and they developed the physician assistant exam. So they've lots of experience. And they tell us that our exam has had fewer bad questions that had to be dumped.
Okay.
So we really polish those exam questions. And so they are good. They are effective at differentiating between the well-trained coach and the not so well-trained coach. So it's a robust exam. And then what happened is that the U.S. Department of Veteran Affairs, the VA,
yes.
We wanted to begin to track coaching services. They use CPT codes, billing codes in the VA, even though they don't bill anywhere. But they use them to track services, and they wanted to be able to track health coaching services. And so they partnered with MBHWC to approach the AMA. And we got approved in May 2019 CPT codes for health and well-being coaching. These are what are called Category 1 codes, which means that they're the entry level. And then we had some folks oppose the codes about 6 months later, and we were back to the AMA CPT panel in February last year to convince the panel to maintain the codes as they'd originally been designed, which included the statement that the coach is a non-physician healthcare professional certified by either the National Board for Health and Wellness Coaching or the National Commission for Health Education Credentialing. So what happened is that in the first discussions with the panel, the what you fondly called NCHEC, the National Commission for Credentialing Health Educators, approached us about, because we hadn't spoken to them about these services, they approached us about being included in the qualifications. And we agreed. And one of the reasons it was important for us to join forces is that at the same time, in parallel, I was leading the group discussions with CMS about coaches using Medicare codes, CPT codes that Medicare pays for. And in the when the Affordable Care Act arrived in 2008, it's a while ago,
Yeah.
they introduced the health educator as a professional for the first time, as a professional that could deliver the annual wellness service, annual wellness visit, which was the new visit. And with that came along the health educator. And you probably know, though, that that was never defined.
Yes.
The credentials were never defined. So we worked, MBHWC and NCHEC together, joined arms, and went to Medicare together and said, the health educator is also a health coach, and we want your blessing that the coach can be an auxiliary personnel member or clinical staff and be able to deliver the annual wellness visit, obesity counseling visit, chronic care, depression screening, remote patient monitoring. So in fact, the MBHWC and NCHEC are about to put out guidance on the use of those services, the Medicare services together. And then we have the new codes as well. So we've been very much aligned, the two organizations, to move these professions into the clinical setting. And what's very important in doing this properly is that there has to be sufficient services that both a health educator, health and wellness coach can deliver to create a job. Otherwise, it doesn't get established. I mean, that's happened. That's made it very difficult for registered dietitians and exercise physiologists because they don't have a large group of patients or codes, and so it's been hard for them. It's been hard for clinical settings to create jobs, and with coaching being more broad and health education being more broad, we now have sufficient existing codes plus the new codes that now we have the ability to create the job of the coach in primary care, and that is happening. It is happening. So Mayo Clinic in Florida has a health coach who's a health educator. Massachusetts General Hospital has primary care practices with health and wellness coaches. UCSD, Duke, others. So there are a number of big healthcare systems who are employing coaches. And now we're pulling all that group together to share best practices, to align around coaching protocols and workflow flow and outcomes tracking and reporting, and approaching payers with a harmonious request or proposal. So basically, from the beginning, creating science-based coaching protocols, training a workforce, coming together under one unified standard, certifying coaches, getting the CPT codes. We're on the way towards the rollout of the role of health and wellness coach and health educator in the clinical settings.
Thank you for that explanation and for the history, because sometimes it's good to know where we started, where we are, and like where we're going. And as a provider of continuing education credits for CHESS people, for chess folks, I see a lot of people that have interest now in health coaching. And one of the questions that I do get, or like sometimes like a confusion on the part of the health educators is, am I good enough to be a health coach? Can I apply for a job that specifically says health coach, even though I have a chess certification? And one of the things that we're trying to do with the activities that we're having and with this summit is to promote the broad nature of the profession and say, as a health educator, you can do a health coach. So do you think that it is necessary, or it is for a chess individual who is not necessarily board certified as a health coach to pursue the credential behind their names? Or what do you think are your thoughts?
Yeah, great question. The first thing to say is that the certified health education specialist is eligible as a health coach. I mean, that's in the language under the Affordable Care Act, and it's in the language around the new CPT codes. So there is no requirement. And in addition to that, the educational requirements for a health educator are a bachelor's degree in related areas. And so there's plenty of education and background to support the health educator as a coach. That said, the coaching programs, coaching schools are skills training programs, which means that you've got to pass a skills test, so not a knowledge test. You've got to be trained. You need to have several mentor coaching sessions. You need to have. So if you're wondering whether your skills are at their optimum, then as continuing education, it's a great opportunity to add the continuing education, but not necessarily the national board certification. That at this point is not required. So I think my general stance would be proud of what you've already accomplished and the education you have and the credential you have, and for me as a coach, I can say you can never have too much coaching. Coaching's hard. People have messy lives and big challenges, and I mean the work. You know this. As a pharmacist, right? I mean, people have major challenges in adopting a healthy lifestyle and living well. Major challenges. If it was easy, we would not have an obesity epidemic. This is probably one of the toughest skill sets that is in healthcare, to help another human being navigate a path of changing how they live. This is not, if you know the meta-analysis that came out of the transtheoretical model on, I think it's 48 health behaviors, and what drives readiness to change, and the experience of Jim Prochaska in all of this data, the estimate is that 80% of the population is not ready to change any given health behavior. They're in contemplation or pre-contemplation, which means only 20% are ready to go. Those are the easy clients.
Yeah.
One conversation and they're like a rocket, they're off, right? But most people are struggling with not enough motivation and not enough confidence that they can be successful. And so they also have had, in many cases, a long history of failures. They've tried to lose weight, they've tried to get fit, they've tried to reduce their stress. And so there's a lot of deep reflection and self-awareness and insight and mindset shifts that is critical to sustainable change. And that's the coaching skill set that is so precious to everyone. I mean, there's lots of pharmacists becoming coaches too. So, I think there's never, I continually take courses. I'm continually reading, continually writing. I'm working as hard to get better as a coach now as I was, at the beginning. And so coaching is a never-ending journey of learning and growth. And so, so I'd say the more, the better for all of us, including National Board Certified.
Thanks. So we talked about the CPT codes and the work that you guys are doing. My question is how optimistic is the future for that reimbursement or the dollar amounts to actually start coming? And then how long does it, I read somewhere it takes maybe about 5 years of like data showing for, the AMA or whoever approves it to say, hey, we've had substantial data to move this from one level of the CPT through to the next.
Well, there are two things you have to do to move from category 1 to 3. First, you need to have an evidence base that has the optimal mix of high quality studies, randomized control studies, large N's, large populations studied, meta-analyses, diverse locations, high impact journals. And at this moment, we meet the evidence test with all the great work the entire field has done. And my colleagues and I, led by Gary Sforzo, have published 2 compendia of the entire health and wellness coaching literature, screening for the common elements of coaching that Ruth Wolliver at Duke, now at Vanderbilt, led in 2012. So we have a definition for coaching. We screen the entire literature to make sure that what's described in the papers and the studies is coaching, because lots of things are described as coaching, but past. And then all that literature got all assembled and published. And so we meet the evidence test now. So the second thing is we need to show wide utilization, which means that 100, 200 National Board Certified coaches or certified health educators, certified health education specialists have delivered coaching services and reported them in the electronic health record. We have a project now going on with the University Medical Center where we're pulling all that data collection from all the coaches into one place. And then the VA is doing the same.
The same thing, yeah.
So we'll have 2. So that data probably will take a couple years to have enough to say, yeah, it's being used all around the country, even though it's not being paid for most of the time. So that's that path. But we still have all these existing services like obesity counseling and remote monitoring, chronic care. So those there's no delay in putting those into play. And so that is happening. There are medical practices that are billing for coaches delivering those services under physician supervision. So the coach is part of the healthcare team, which we think is very important, that the coach is, because the coach is not a clinician, not diagnosing, not treating. It's important that they're embedded in the team, and the patient's getting appropriate medical care, clinical care, pharmacy support, etc. So at this stage, there are cases of patients sending their bills for coaching services and getting and health plans paying for them. And there's a couple of examples where payers are paying for the new codes. So it's coming. What we're doing now is the folks who have the most influence with payers are the doctors and the healthcare systems.
Yeah. Okay.
And so those are the groups that we're helping, who already have coaches who in some cases are already billing. There's a wonderful physician in Texas who describes the future of primary care is a health coaching practice supported by doctors instead of a physician practice supported by coaches. You probably heard this. So the idea there is that the the coaching skills in communicating with patients and mobilizing them and getting them excited to take better care of themselves are better than other providers. And so I think it's just a matter of time. Then on the economics, what the big shout out to the CDC, who has spent 20 years showing that the important focus for coaching services in terms of getting a fairly quick return on investment are the 35% of the population that have pre-diabetes. About 11% of diabetes, but the rest are, that's a very big group. And in the next decade, they could all have diabetes, which will cost a fortune, because you're looking at, regular healthcare costs going up to $5,000 to $10,000 a year for the diabetes treatment. And if you lose 5% of your body weight, which is not a lot, and you walk 5 days a week for 30 minutes, you can reduce your risk of diabetes when you have prediabetes by between 58 and 71%, depending on your age. And so investing coaching services, say $600, even over several years, because DPP is just a 1-year program, but people aren't done yet at 1 year. It takes a few years to turn around an unhealthy lifestyle that's been going on for a while. So basically, if we can invest, we can save a lot. And so that's where we have the financial opportunity. I was involved in building a coaching protocol, an intensive protocol, which combines individual and group coaching for fibromyalgia. We were able to show an 84% reduction in medical utilization with a 1-year program. Now it's an intense program because that group requires a lot of leaning in to create a almost, extreme level of well-being in order to be able to live well every day and function well, and to become independent of their providers. And so we know that coaching can work for very difficult situations as well. So chronic pain is another area, and then of course there are people who are the mathematical predictive modeling shows that their risk is going up. Their risk is rising quickly, and they need to make some shifts pretty quickly. And they need shifts in medical care, but they also need shifts in self-care and healthy habits. And that's another place. So I think the important thing about introducing the coach on the healthcare team is to use that resource where we can make a big health impact and financial impact in the next, 4 or 5 years.
Now, I know you've mentioned working with the physicians and the health systems. What about the disease prevention programs like Livongo and Vita Health and Noom and the rest of those that also utilize coaching, but are not necessarily, your doctor's office type of visit. Right. But that's another aspect where
there are lots of so there have been what I call cloud-based coaching services for a long time. So way back, do you remember in the 90s we had chronic disease management services? Big teams, big call centers full of nurses, right? And then that was followed by health plans delivering their own internal disease management programs, and and also decision support and those sorts of things, and some lifestyle as well. And they delivered those to employers. Now we have a whole group, and I'm consulting some of them. Some of them called this digital therapeutics, which is sort of software plus coaching. Yeah, there's a lot of those, and they're upgrading the quality of coaching and using software well, so they're getting better results than in the 90s because the chronic disease management world, you'll remember the CDC reported that all the randomized studies showed there was no significant improvement in behavior change or cost savings. And then the health plans have a lot of programs too, but they don't have good utilization.
Sure.
And they often don't have highly trained, highly qualified coaches. They're sort of checklist based. The conversations are not meaningful and reflective and making a real impact. And so this new group of cloud-based services is more sophisticated and is using, many of them are using, and many of them are supporting the national board certification and have national board certified coaches. So basically, so that is another avenue. And in some cases, health plans are delivering those to employers. Sometimes they're direct to the consumer. Sometimes it's selling through clinics. There's lots of different paths for those groups.
Now, are those types of groups or organizations, are they eligible to track using CPT codes? Or is it because they're not directly in like a doctor's office per se, they're kind of excluded from using the tracking or
so in order to report the code, you have to have access to an electronic health record.
I see.
Which means that you are part of a healthcare system in some way. And so generally that would mean that you're embedded in the healthcare system. And in specific clinics. So yeah, it is meant to be a healthcare. The good news with the new codes is that they can be delivered virtually. So in theory, a clinical system could partner with a cloud-based program and figure out how to document the services and get reimbursed. So yeah, I think that's entirely possible.
Because especially with COVID-19 and how it's kind of changed the spectrum of care and people, using telemedicine a little bit more, employers having to engage their employees from a distance or have to do those programmings online or pre-recorded or what the case may be. I think, at least in my opinion, I think that as the change that we're seeing coupled with technology is going to open up a whole different space for more of those type of collaboration and startups. Already we have the startups in healthcare that are, utilizing the digital technology. Like 20 years ago, we didn't have what you could find like Vital Health or something. Now it's different options. And I was reading this article too, where, for employers to stay competitive with their benefits, they have to be in tune with some of these, sophisticated things and newer things that people do want in order to, make their employees healthier so they can get the return on the work that they want the employees to do.
Yeah. So, I love technology, and Well Coaches has had a web coaching platform since the beginning. We launched we had video conferencing in 2001. Mm-hmm. And a web file. We're just launching right now Well Coaches Digital. So this is my Well Coaches World, which is a web application, and the patient has or client has their own web app. They have an app to help manage their lifestyles and their biometrics and their habits and their coaching process. And so I think, and there's much more to be done with the technology. So imagine Siri giving you a little, remind you said you were going to, drink your water today, or, stretch in between meetings, or whatever your habits of choice are. So yeah, I think the marriage of the human coach for the deeper reflection and deeper exploration and overcoming, overcoming growth edges, wherever you're stuck, how do you get past that? Things. I think that's a human conversation, but there's lots that can be done in what I call the last mile, which is supporting the habit change, picking habits, testing them, engaging in them regularly, making sure they work. If a habit if you don't notice some benefits in the first 2 weeks, drop it, move on. You're not gonna, You're just not going to be able to sustain something that doesn't feel good, that doesn't make you sleep better or feel better or, more energetic or, whatever. So yeah, that whole habit making process, I think, can be delegated well to technology. So I look forward to the continued, collaboration of human coach, the skilled coach with the technology.
Well, thank you for all the information and the history and everything you shared with us. Before we end, are you able, what's I guess words of encouragement or suggestions do you have for health coaches who are getting started, people who already have, like I've talked to some board certified health coaches that are still maybe trying to figure out where their niche is because they feel it's so broad and they're not really sure how to market themselves, or the ones that do want to get into the healthcare system, how, what words of encouragement or suggestions do you have to offer?
I think the most important thing is to become a very skilled coach that is effective. Because no matter what path you go, your results will be what creates your career, right? And so I think marketing is important, positioning is important, but I would start with coaching lots of people, even if it's for free. Get as much experience as you can. I think sometimes coaches get out there and, it takes a few years. I mean, it's really 4 or 5 years before you're really good coach. I mean, you can be good, but being masterful, so your impact is good, but not great at the beginning. That's pretty much the norm. And so the most important thing for the field and for each of us as coaches is that we are very effective and our clients are successful. And if that impact consistently is powerful, then we'll never want for enough clients or a good job. So I would say focus on your outcomes and your results, and the rest, not that the rest doesn't matter, but the rest is second, because it's easy to put a shingle up as a coach, even if you're national board certified, even if you've gone through all the training. The truth is the field won't survive if we don't get great results consistently. All of us, and the field will, the best coaches will do better than the folks who are moderately good. And so I think that just like any profession, what matters most, I mean, you have to check all the boxes in order to be a good professional. But the truth is that when you are engaging with another human being, your impact is great. That's what we need.
Well, thank you so much, Ms. Moore, for your kind words. And thank you for joining us today.
Thank you, Chinelo. It's been my honor. Thank you.
Perfect. All right, so for this session, we are going to have some real talk with a real health coach. She is Ms. Zikea McCurdie. She's a board certified health coach. I'll let her introduce herself and we'll get started.
All right, perfect. Hi, everyone. My name is Zikea McCurdie. I am a board certified health coach as well as a yoga teacher in training. I also have a master's in integrative medicine, so I bring more of a holistic standpoint to my coaching sessions. I like to help my clients see things from, a holistic point of view. So not just looking at their physical body, but also their emotional wellness, spiritual wellness, and bringing that all together to help them create long-lasting habits.
Okay, so how did you get started as a health coach? Did you get the master's first and then you became a coach, or it just happened?
So my journey was really interesting. I actually started out in a master's program for social work because I thought I would go into social work and be a licensed clinical social worker and go into like therapy. But as I started to go through the program, I realized it wasn't resonating with me. Something that I was always interested in was, holistic medicine. So I started to do my research into different things that I can do to support people's health and wellness. That's what brought me to my master's program. So I enrolled, and as I enrolled in the program, I started to learn about health coaching. And I was like, this sounds pretty cool. Like, I think this would be really nice. I can like help people build the habits so that they don't have to keep going to like doctors repeatedly. And then I saw a listing for a job at Noom, and they were looking for an entry-level health coach. And I said, why not? Let me just give it a try. And I applied and got hired. And from there, I just hit the ground running. And that's also where I got my certification. That's where I learned to refine my coaching skills. And it just helped me just all around in all areas. I was also having my own health issues. So I had IBS, and I knew I had to change my habits, and I was struggling with it at a point in time. So I had to like coach myself. And after coaching myself, I was like, I want to help other people who might feel like this too. So that really like pushed me to take coaching extremely seriously and brought me to where I am today.
Okay. Yeah. I'm glad. I think when I met you, I forgot you had worked at Noom. And Noom was one of those. I remember even in my days as I went through my career, getting started in my career, I used to see all these advertisements for Noom Health Coach. And so it's good that you mentioned it, because it's one of those big corporations that is really into health coaching. And they do a number of other services too, like diabetes prevention.
Yeah, they do. They also offer like a DPP program. So individuals who are signed up with Medicare, they can get it for free. They also have coaching, and now they've expanded it past weight loss to stress management too. So
and it's kind of interesting to see how some of those companies are evolving and their programs are growing. Because at the time when they started, looked like I was able to see them at the beginning stages, and now, with the focus on health coaching is so much more that companies are doing. So you mentioned that you got started with your certification while you were at Noom. Can you tell us a little bit about it? Because the audience that we have, some people have questions about, the board certification and how to go about logging their hours. So can you speak a little bit about that?
Yeah, of course. So Noom actually offers a program called Noomversity, and they open it up to all the health coaches on staff. And it's a certification program. It takes you through the principles of motivational interviewing. It completely preps you for the board certification exam. It was from end of April 2019, end of April 2019 until August. So it was about 4 months, a little over 4 months. The program was really in depth. We used the coaching psychology manual. That's going to be like the key to passing the test. And the way that we logged our hours, because we were already coaching for work, they kind of just wrote up something for us that said, hey, they did their hours, and they sent that over to the national board for us whenever we did register. So whenever we completed the program, they sent us a packet with the hours certification, with the curriculum certification to say that we had completed the curriculum as well. And it was also something to say, like, we had the perfect prerequisites for the exam to certify us. And we sent that over to the national board. So if you aren't going through Noom, because I know not too many people are as lucky as I was to go through Noomversity, what you do is when you enroll into a health coaching program, I had a friend who did it outside of Noomversity. What she did was she went on Instagram and she opened it up to her followers, to her family members, her friends, and she coached them through there. And that's how she built her hours. So whenever you're getting started out as a coach, don't be afraid to tap on your network. That's going to be the perfect way to get your hours in quickly, because you're probably going to end up talking to your friends about it anyway.
So I'm great. I'm glad that you mentioned it because a lot of people, when they're getting started, they're confused as to where to go. I must have a master's degree and all this type of stuff. But it's good to know, and I've thought about it for myself on my practice as well. Open up something and then get started. And I noticed, I don't know how I even forgot to mention this. Zikea is one of the instructors for Pharm PH, which we launched a certificate program in fundamentals of health coaching. And so when I was interviewing instructors to come on board, I looked at her resume and what she had to bring, and I said she has to be a perfect fit. I need to have her on board. So I'm glad she is able to join the team, and I'm glad she's able to do the interview with us to share some of her tips. But it is good to know for people who are getting started other creative ways as to how to build their hours and get more experience doing it. Because like you said, your network, they're going to know that you're doing health coaching anyways. You might as well tap into them for the hours that you need.
And another thing about the hours, sometimes when you look at the number, I believe it's like 100 hours, and it can look really intimidating where you're like, 100 hours in. But if you pick up maybe like 3 to 4 coaching participants and you coach with them maybe once or twice a week for just an hour, those hours go by really quickly. And whenever you're enrolled in the program, they do tend to give you tools for you to advertise and market yourself as a coach. And then you'll send your hours back to whatever program you're in. But yeah, don't let the number of hours intimidate you. It goes by really quickly.
And I think also too, because some people in the audience don't have the board certification, and some of them are straight up chess or NCHES individuals that maybe not necessarily want to go through another level of training or what the case may be. So these are some tips that you can build yourself up and build your skills up as a health coach if you're able to set something up like this for yourself and work clients through. And I think too, with the courses that we have, we've gotten some great feedback that, they're really good information for people that are starting out. So for those of you who are curious or want to learn more, definitely feel free to sign up for some of those courses. Now, have you found that the board certification has opened up doors for you or paved ways for you for other opportunities? I know you currently don't work at Noom now, but you're somewhere else.
The board certification is actually what helped me get my current job. So currently I work in corporate wellness. I'm a health coach and wellness consultant for the largest hospital system in New Jersey. I currently oversee the wellness programs for 6 different hospitals, and I wouldn't have gotten this job without my board certification. It prepared me in ways that I didn't even realize, because I didn't have that CHES background. So I didn't really learn much about health education. So that's where you individuals who do have your CHES or your MCHES have like the leg up on me. But whenever I got my coaching certification, that's when I started to learn all of the similar things to what's in the CHES program. So another thing I would love for you all to know is health coaching is very similar to health education. It's just the different principles that you use as you're coaching. That's what makes the difference. So you probably have a ton of the skills down pat already. But as I got my certification and opened that up for me, it opened up different opportunities to partner with community organizations because it differentiated me from other individuals, because on social media, there's a lot of different coaches who are popping up and different wellness influencers. And sometimes the information isn't as reliable. So a lot of different community organizations are a little iffy about who they like to partner with. And I'm very interested in community health. So having my board certification helped me to build those partnerships and to start getting more involved in my community as well.
Okay. And so compare your experience as a health coach while you were at Noom with your previous employer versus now that you're in corporate wellness. What was your day-to-day experience at Noom like versus your day-to-day experience currently?
Oh, it's like night and day. At noon, things were a lot more like flexible. I would sign on to a dashboard and there would be maybe between 300 to 500 messages waiting for me every morning. Some from my coaching participants, some that were just alerts to check in with my coaching participants. And I would engage with my coaching clients through text message. So I would just respond and check in if they had any questions for me. If it was their check-in day because they set a goal, I would send a message to them to ask them, hey, how's your goal going? And that was pretty much my whole day, just interacting back and forth with them, organizing some of my information. And when I moved into becoming a group coach at noon, then it was, planning my group posts, because that would work more like a Facebook group, going through the different groups, checking to see if anybody's saying anything that's a little alarming, providing a little extra support where individuals may have needed it. So that was primarily just coaching. Currently with MedPro, as a wellness consultant in corporate wellness, I have a myriad of different responsibilities. So I have my telephonic coaching calls, which I love because I love hearing people's voices and hearing them kind of move through the process and learn different things. And it's so amazing because, I feel the rapport, it's better to build via phone than through text. So aside from that, I'm also creating programs for the employees. So I've created a resiliency bingo program, which was like a bingo game, but different stress-reducing strategies. I've created a virtual summer camp for the employees. So it had different activities from recreation to, we had different like workshops about mind-body connection. We had yoga classes, dance classes. It was amazing. So day to day, I'm creating programs, reaching out to HR, health coaching. I'm also working with my team to continue to think about partnerships and how we can partner with other organizations and bring them into the hospital. There's a lot more moving pieces in corporate wellness than there was with just coaching. And that's another thing I love about the coaching certification is when you have that, you can do so many other things like creating the programs in corporate wellness. While I love just coaching, but programming is my favorite.
Okay, I'm glad you mentioned that as a health coach because, and you said it earlier, health coaching and health education are pretty similar.
Mm-hmm.
The core education is there, the principles of motivational interviewing, but the difference is a little bit of the other level of skill that you bring. The coaching skill is what probably health educators need to build on a little bit more so that they can, bring that expertise of a health coach. It's like the stuff that you're talking about, like community programs and developing, those different events are pretty much right up the alley for health educators. But so from your experience, have you found it to be a rewarding career move? Is it something you see yourself being in long term?
Yes, it's the most rewarding thing ever. I'm happy that I took that leap when I did, because I did kind of go through a little bit of a back and forth whenever I was trying to decide to leave social work to go to health coaching, because it was like, one, I knew that I had like a career in it. Social work is something that has already been established. I knew I had a journey in there, while health coaching was something that was a mystery to me because coaching wasn't as big when I started in 2018 as it is now. So I was like, I don't know, what am I really going to do with this? Where is this going to go? But now I'm so happy I did it, because looking at the future of coaching, I'm just like, I made the perfect move, and it resonates so well with me and what I feel like I want to do and my impact on this world.
Okay. So it seems like, I don't know, correct me if I'm wrong, you've kind of found your niche a little bit in corporate health and wellness, which sometimes too for health coaches, another big struggle is, well, where do I, find my niche? How do I narrow myself? Because as a health coach, you help people with a little bit of nutrition, you help them with sleep, you help them with stress management. Sometimes it kind of looks like it's too broad, but you can't really focus. But, at the same time, you can if you find that niche. So, I guess, can you share more tips or more advice about people who want to go into corporate health and wellness. And I also mention it because it's one of those areas of or industries that is set to experience a huge boom, especially with cost of employees healthcare rising. I've seen as over as $13,000 per employee or even more. So can you speak to us a little bit about the corporate health and wellness and finding your niche in that sector?
Of course. So into corporate wellness, it was a bit of a challenge. I'll be honest. There's so many different things happening because wellness is changing every day, and you also have to know your audience. So when you are trying to enter corporate wellness, make sure you're working with a employer or an insurance company, or you're partnering with an agency that resonates with what you value. So I decided to work for the hospital system, and I loved it because I always wanted to work in a hospital, but I realized how much stress hospital workers were under, and I was like, I don't know, I don't want that side of it. But I was inspired by, recent events to support these frontline employees, and that's what really brings me joy there. In corporate wellness, another thing you want to work on is, it's not just programs, because I think a lot of people, when they come into coaching, they only see like one part of it, like the programs, the coaching and interacting. There's so much that's happening on the back end. It's the admin, it's connecting with the higher ups in the hospital or in the corporation so that they gain your support, because that's always really important in corporate wellness. If your managers, directors, CEOs aren't supporting the program, it's going to be really hard to get buy-in from everybody else in the hospital, in the office. I'm trying to think of how to label it because I'm going to say hospital because I just work in one. Another thing in corporate wellness is you want to network, and build wellness champions, because you won't be able to be present for everything, especially if you are working with multiple different agencies offering your services. So you want to be able to empower those employees to start to build initiatives as well. So we have a wellness champion network of about 50 different employees across, I think, 10 different hospitals, and they will come up with their own wellness events and just send messages to us like, hey, I'm thinking about doing this. Is this a great idea? Having wellness champions helps to spread your initiative of wellness on the campus. Having an employee saying it creates more buy-in. Another thing too is you want to make things as convenient as possible for the employees. That might mean a little bit more work on our part, but when you're going into corporate wellness, you're already working with people who are stressed, sick, and tired. They're already finding it hard to find time to be well. So to add another program in, it's going to take a little bit more of their time. That's a little inconvenient for them, and that can sometimes turn them away from the program. So what we do is we create the appointments for them. We call them. A lot of our programs are virtual because it makes it easier for them to engage when they're off of work. We do things during their lunch break hour. And another thing, you want to make sure you know exactly what the employees need. So that might be using a health risk assessment and seeing where they are currently. That might be looking at previous insurance claims. That might, if you're like tied in that way, because we are tied into their benefits network. So we can kind of see what happened the previous year in their insurance claims. It may be just speaking to some of the higher ups there to know what's happening in their departments. Are a lot of employees out for injuries? Are a lot of employees out for colds? Are they out for stress related stuff? Is it finances? And creating programs around that. I think those are, my top tips for corporate wellness, like making it.
Thank you. And I'm sure those are very useful tips for the audience. And I know myself in the past, I used to, and I still currently am, an ambassador for the ADA, which is the American Diabetes Association, and we'll do a number of things. And with my public health background, I love to be in the community as well. So anytime they would have like outreach stuff, I would try and go if my schedule permits it. Then I would meet some of these corporate health and wellness individuals, and they're doing all these tables for the employees, and so I've kind of seen a little bit about how that works. But I'm glad you mentioned the claims data, because some people kind of like, well, struggle, like, how do I find information to set up a program? How do I know? But if you look at the claims, it'll tell you, the claims for diabetes or for blood pressure or what the case may be. Now, we know of course, COVID-19 changed a lot of things for a lot of employers, a lot of employees, and a lot of program management's changing too. And I'm seeing, I read this article on how employers are kind of shift away from the typical standard things that they would do in the past, like, you have complete this questionnaire to get this incentive. Some people are like beginning to see we really need to take care of our employees or bring health coaching in, because the data is there, the positive reports as to the benefits of health coaching. Is that something that you've noticed compared to when you first started to where you are now, and the trends that are changing with corporate wellness?
So I definitely see that society as a whole is starting to see the benefits of health and wellness coaching more. So when I started, there was only like Noom. That was one of those like wellness apps. Now, when I look on the App Store, there's Calibrate. There is like Weight Watchers, who has the health coaching aspect. So coaching is growing because people are starting to realize the benefits of coaching. There are people who are now, doctors' offices are looking for health coaches to work with. When it comes to corporate wellness, more and more employers are looking for people who can help to, one, reduce stress levels. That's the main thing that many corporations are looking at now from health and wellness coaches, are like stress reduction and nutritional advice. Those are like the top two topics. But something I'm seeing in medicine now, or in coaching now, is like a draw towards like personalized medicine, gut health, all of those things. So now corporate wellness is starting to look more into that area. Like, okay, so how can we personalize this experience? How can we give the employees something that they can take home and they can apply to themselves? Another thing that I'm starting to see is disease-specific coaching. So there are more corporations who are looking for, diabetes prevention programs. One of the things that was a hit with ours was we did it was like no sugar added challenge. So we were challenging people to reduce their sugar intake. And we had, I want to say, like 100 people signed up in the middle of like December, which is prime sugar time. But that showed how that's what employees are looking for now. We created a SMART goal webinar as well. And in the first week, we had 75 people sign up. People are looking for help with creating healthier habits. Because of COVID-19, people are more aware of their health. And because the corporations recognize that too. And of course, they want to capitalize. So they're bringing in more and more people. There are so many opportunities in coaching, especially if you can niche down. Because another area that's growing too is children's wellness. Nobody has tapped into that area. So being able to provide things for parents and their children, that's another thing that's growing as too. I'm trying to think what else. It's really around more of like natural, keeping things all natural and focusing there and moving people away from, well, what people are moving away from is more of that like treatment and more prevention. So corporations are just looking for things that are focused on prevention. That's going on with coaching. Yeah. Just really specific prevention.
Thank you for that information, because it really does help. And even from my experience too, I've done the gut health programs, I've done these other things. It would have been nice if, the company covers, some of these things, but it only just takes time for that information to be out, and people are like, hey, employees need these. So, everything is just about time, evidence, and seeing what the benefits are, and then bringing it out to the public.
Yep.
Now, one last question, because I know you've been doing coaching throughout this pandemic. What has the virtual engagement been like for you with the employees and your clients?
So when we first started in March, it was like zero. They were not engaging, but then again, it was the beginning of the pandemic. So that's totally understandable. We ended up getting overall engagement rates of 65% of the employees throughout the entire hospital system engaged with our program through the year of 2020, which was great for us because that was actually our first year in that hospital. So we had just revamped the program. When it comes to coaching, I would have between 20 to 25 coaching sessions each week between the hospitals. So that is about 100 to 150 a month. In any of our virtual programs, our resiliency webinar, we had the highest turnout. We had a total of 500 employees come to all of our webinars.
Wow.
Yeah. We have in all of our programs, we have a minimum of 50 employees sign up to any of our virtual programs. Anything that we have that has videos that are pre-recorded, we tend to get the highest turnout. So we had a race, it's called Running with the Devils. So it's a 5K race that we partner with the New Jersey Devils with. And we did a 8-week training program to prepare for the virtual 5K. And we had a total of 300 employees participate in that. For any of our live classes, there was a minimum of 10 people there. Like, people are really loving virtual events right now. They're convenient. People, especially if they're pre-recorded, people can do them anytime that they want. They love it. Really great engagement when it comes to virtual events. The only issue that we had was kind of informing them about the virtual events, because they're hospital employees. They were getting emails every day on updates about the pandemic that are kind of get lost in the sauce. So we had to start being innovative. We had our ads on the screens in the cafeterias, and then we started to see the increase come back from that too. So we had ads on the screens. I would go into the hospital like once a week to just set up signs everywhere, and that helped too. So just making sure people love virtual programs. It's just making sure they know about them. That's where I find the disconnect comes in.
You have been a wealth of information today, Zikea. I really appreciate it, and the answers and the tips that you shared, because these are some things that I'm sure are on the minds of the audience and people looking to narrow themselves down or find their niche in health coaching, or people looking just to get started so they know what's out there. So I thank you very much for your time today. Thank you for being a part of the Pharm PH team. I really, really appreciate it. And I look forward to more things. And thanks again for being a part of this.
No problem. It's been a pleasure. Thank you for having me.
Good morning and welcome to this session. We have a great speaker with us today, Ms. Suzanne Lineberry. She's an experienced center director with demonstrated history of working in hospital and healthcare industry. She's currently a director of Center for Quality and Improvement up in North Carolina. She is a very talented chess individual. Looking forward to having her, and I'll turn it over to her so we can get started.
Well, thank you. I appreciate your time this morning and the opportunity to kind of share some of the experiences I've had as a health educator and health coach working in a clinical setting. As we know, it's not easy for health educators to kind of break into that field. And so I feel very fortunate that I had that opportunity several years ago, and I'm just excited to share sort of some of the things that I've learned.
Okay. Well, so you mentioned that you're a health educator, and we can see it with your credentials as a chess. Can you tell us a little bit about your experience and how you got started in the health coaching as a health educator?
Sure. Yeah. So I I am a first generation college student. And so when I was filling out my college applications, I knew I loved health and I knew I loved education and knew nothing. I didn't even know public health existed as a field, but kind of as going through that application project process, they ask you to pick a major. And so it seemed like public health, if we combine my two favorite words, right? So it seemed like public health would be the right career choice for me. And when I had told my parents, they were a little shocked. They thought, are you going to have a career? Are you going to make any kind of money? I mean, what kind of things are you going to do? And honestly, it was through the process of my undergrad that I really truly did love, and public health was the right field for me. I loved all the classes, all the biologies, and marketing and grant writing and all those things. And so I really learned to love the field as I was studying it. And then I was able to go on and get a master's in public health. And during that whole process, I was working part-time for the university and doing health education and public housing, and got to know a lot of the faculty really well through that, and creating student experiences. And so I was promoted when the opportunity came to work in a clinic. I was promoted as I was given references to go into that clinic and start doing health coaching. At that time, this was about 2011, health coaching was fairly a new concept. It had been around a few years before that. There had been some training programs, but health coaching in general was kind of emerging at that point. And so I was able to get on and get some coaching through a program out of Colorado, and then started working in a clinic with patients one-on-one. And so it really, where I've ended up now really is about relationships and just being able to network and put myself out there and try to do good work. And they kind of promoted me through to different opportunities, and I'm grateful for those people.
I'm a chess as well. And then I remember at some point when I was going through like, what can chess do? And I try to update my skills all the time. And I came across a paper that you co-wrote with a few others. And it's titled Adding Health Education Specialists to Your Practice. I saw the article like many years ago. But I keep coming back to it and keep coming back to it. And then finally, like sometime last year, I forgot what I was looking at, like annual wellness visits, and that came back to me. So I thought that's a great article or a great journal writing to talk about with our audience today, especially since most of them are chess folks like us. Can you tell us, about what that project was all about and how, some of the outcomes from it were?
Sure. And I'm going to share my screen so you can see sort of the title page. So as I mentioned, in 2011, the opportunity to be a health coach within a primary care setting came up. And there was a clinical lead, Dr. Chambliss, and he's the first author on this paper, who was really the pioneer in this and said, hey, I want to augment my care team, and I think a health coach is someone we need. And so I got in there early part of 2012 and really had to figure out how to reimburse myself, right? How to bring value to the clinic financially, because typically traditionally there was just no billing services for health educators. And so through the annual wellness visit, which is what this article was about, we found ways to bill, and I'll go into details in a minute about that. But the summary of this article was to be practical. It's in the Family Practice Management Journal, which is a very like hands-on kind of journal. And so Dr. Chambliss and I were like, we need to get this out there of like, technically, what's the workflow like? How does a health coach fit within the care team? How do you bill for that coach? How do you document? And so this paper really summarizes the 3 roles that a health coach or a health education specialist can do in the clinic. One being a health coach and working with patients on behavior changes one-on-one, such as tobacco, diabetes, stress management, things like that. But then there's also another role, which is, and it lays it out right here. So there's a health educator where you're educating patients, the health coach working on behavior change, and then practice quality coordinator. And see, originally I hadn't been brought in to be a practice quality coordinator, but kind of my love for population health naturally led to that. So I'm working with patients one-on-one, coaching them, but then taking a step back and looking at all the patients within the clinic who may be struggling with diabetes. How do we look at the data? How do we meet federal and state guidelines, how can we get incentives for doing sort of this larger scale population work? And so this paper, again, kind of goes through those roles, explains what you would be doing in those roles, what kind of certifications you may need. There is a little blurb about why you wouldn't use a registered nurse or certified medical assistant for this. That often we compete for those jobs. Have you seen that? So it's not downplaying at all. In fact, the paragraph sort of mentions we have a shortage of nurse. Let's the nurses do what their nurse have been trained, their nursing skills, where we can augment and add to that team and add sort of that behavioral change coaching aspect versus retraining nurses who are already in short demand of. So it goes on to talk about the practice experience. Again, it outlines sort of the roles and certifications that you may want working in the clinic. And then here's like what everyone wants to know. How much do we get paid for, right? So again, this was published, I think, in 2014. Yeah, 2014. Prices may have fluctuated just a little bit since then. However, you know, wellness visits paid anywhere between $100 to $175 a visit. And so easily, you know, health educators, we don't start making high dollar salaries, but we figured out that if I did about 400 annual wellness visits a year, meaning with 400 patients, that would be enough to cover my salary. Anything above the 400 would be revenue for the clinic, or, you know, adding to the bottom line. And, you know, they took about an hour each. So technically that only takes up about 400 hours out of a typical work year of 2,000 hours. And so that allowed me flexibility to be coaching where maybe I didn't get paid, or maybe I was doing population health, again, where I wasn't necessarily getting paid for my services, but it created that opportunity and cushion to do sort of all those things within the package of my role. And then it just kind of closes out with some walkthroughs of how I interacted in the clinic with the physician, how we moved a patient through the physician. And so that's really the gist of that article. Did you have any thoughts or comments?
Yes. So let me take that out. All right. So annual wellness visit, can you talk a little bit more about what it is and how the health educator fits into it? Because I know as a non-physician healthcare provider, it's a service that health educators can do within the medical setting, but they're not necessarily aware that it's something they can do.
Sure. So I think of the annual, well, first off, it's a Medicare product, meaning it's only billable with the Medicare insurance or Medicare Advantage products, you know. So I think of it as a well child check, you know, well child checks for kids. Well, it's a well child check for adults, right? So it's an annual wellness visit. It really should be focused on screenings and wellness. So there's the reason why it takes 45 minutes to an hour is because you're doing a really thorough workup. You're doing fall risk assessments, you're doing cognitive assessments, depression, anxiety. You're looking at their gait, how they walk. You're talking about all their preventative screenings. Have they had a mammogram? Have they had a colonoscopy? And so there's quite a laundry list of things that you go through, and then you give them a personalized care plan at the end. So based on everything you've talked about, you know, some next steps. And so you can see there how that visit includes both health education, but then also health coaching to move them towards a behavior change, right? So that's really the visit, and they're paid every year. The first year you join Medicare, you can get that visit, and then subsequent ones are forever, as long as the patient wants to participate. It does pay less each year, but that is a good chunk of money in the beginning to help cover your salary. The pushback that I got most often was because we had started this, like I said, back in 2012, was patients would come and expect to see their provider. And so when they saw me, they're like, wait a minute, is this a physical? And traditionally, Medicare does not pay for a physical. And so there had to be a lot of patient education around what to expect when you came. You're not going to see your doctor. You're going to be working with a health coach, a health educator. And then if there's a problem, like say there is a medical condition that's really critical, we'll move you to see a doctor. But really this is to focus on your health, which again, we're best suited for as health educators, because often what I heard providers saying is they have this Medicare visit scheduled and they have to get through so much stuff but all Jane Doe wants to talk about is her knee pain.
Mhm.
And because he's clinically trained and licensed to do that, it's hard for them not to go to there. So often wellness visits turn into sick visits. Where with me, the temptation's not there, because I say, that knee pain sounds really, really terrible. Let's get you to see the doctor tomorrow, or maybe in 30 minutes, you can have a visit with him. But right now we're really focusing on your wellness. And so that patient education experience really, it's evolving. And I think patients are getting more and more used to it, but it was new at that time.
Now, so 2 questions that came up. What was the marketing piece like for you guys when you were starting to do it? And I remember you saying that if you figured out was 400 patients in the year, were you able to hit that 400 patient mark and exceed?
So I got close. I did get close. So I came in right as electronic medical records was switching to the clinics. So which we now know is kind of a nightmare for a while and a disruptor, because you're trying to figure out the new way of documenting and transferring patient records and stuff. But I literally started a week before they switched electronic medical records. And so I was kind of left to my own devices and it was a little overwhelming, but I just figured out how to pull reporting really quick and figured out who was eligible, right? So the first step was, how many Medicare patients did I have in the clinic? How many had already a wellness visit? That was pretty simple because there was only 10 done previous to me arriving. And so who is eligible, and then create some marketing, like you said. So it's a marketing to explain to patients what an annual wellness visit was. We did a bunch of letters back then, which doesn't seem that long ago, but honestly, that was the way we did it in 2012. Like, we did a lot of mail still. And so there was mailers and phone calls. So I'd work just a patient list and say, hey, and explain what it is. As years went on, some of the Medicare Advantage plans like Humana and Coventry and all that, they started marketing it, right? So go get your annual wellness visit. And so we kind of got that push from the private insurance, and even some like United Healthcare incentivized patients. Like if they went and got a wellness visit, they would get $100 Visa gift card or something. And so we started playing on that and appreciated the private payer marketing. It was hard. It was hard at first. They didn't. I did do a survey the first year. I tried to survey the patients I had seen. And they were okay with it. It was just so different from a typical office visit. They got an hour of time with someone, and I wasn't drilling down into their pains and medications. It was a part of it, but it wasn't the focus.
It wasn't the focus.
Yeah. Did I answer your 2 questions?
Yes,
Okay.
you did. One thing, when that was a really great article for me, especially as a provider for CE credits. I've been looking at ways to, make activities more lively and productive. And so people, when they're actually doing continuing education, they have some, they feel like they're really building their skill or adding to their knowledge. So it was something that's been on my mind to do something like this. But when I was reading the article, one thing that struck out to me was pretty much the similarity between a health educator and a health coach, because some people think, well, I don't have a health coach title, I have a health educator title. But, in talking to some of the other speakers throughout the summit, they're like, you're qualified enough as a health educator.
Yeah.
You just have to add a few things to your bag to up that level of your service to your patients. So can you talk about those similarities from the project and even from your experience working sort of both roles?
Sure. So I, as I mentioned, I have a bachelor's and a master's in public health. And so the skill sets for that are really a deep dive in health behavior theories and models. The sort of the academic side of why we do what we do. But there are, I think it's really just a name sort of, they're very similar, right? So a health coach is typically a certificate that you get. It could be from a state program. I was involved with University of North Carolina, Greensboro's health coaching certificate program, getting that off the ground. And so it could be affiliated with university, but there's also a lot of private entities and counselors and stuff who certify people in health coaching. When I started, there was no national there was no national certification for that. There was for health education, but not health coaching. Of course, like the CHES or MCHES for education. But now we've moved forward so fast and quickly that there is a certification. I think it's called, I don't know what the acronym stands for.
The National Board for Health and Wellness Coaching, the NBWC. Yeah.
NBWHC, yeah. So back then there wasn't even a national standard. There was programs that I did go through, but some similarities would be between both sort of titles, because I don't even think they're different jobs. I think they're just titles. One is that we both work with at the individual level for behavior change, right? It's about that one-on-one interaction. It could be a family unit that you're working with, but we're not counselors, right? So we're not counseling for traumatic issues. We're really coaching for behavior change and creating accountability. I think both titles have a foundation in knowledge about behavioral theories and models. And I think both titles use the pillars of health education, right? We assess the patient, we make a plan, we help them implement it, and then we evaluate the patient, right? So we're using those 4 pillars of education, health education, in both sort of roles. The difference is, and also similarity is that we can work in a variety of settings. So we can work in a clinic, we can work in a health department or a hospital or even schools, right? We have that flexibility for settings. Some differences, health coaching, I think, really drills down onto the skill set of communication. Really, how do you communicate and how do you activate the patient for change? You get trained in motivational interviewing. It's really an exercise for me anyway. It was in how to communicate, how to translate sort of that knowledge of behaviors and theories and translate that to a patient so that it activates their internal motivation. I don't know this for sure, but I don't believe you have to have a bachelor's to get a health coaching certificate. I think that depends on the program you go to, but I've not known of an actual requirement for a bachelor's degree. Whereas health educators, of course, you have a bachelor's degree. You can sit for the national board, the Certified Health Education CHES exam. We have a deeper knowledge of the behavioral theories and models. And we also have a deeper knowledge of just conditions and health conditions, right? Like we take communicable diseases, we take anatomy, physiologies. And so we have really that educational foundation of what these conditions and diseases are. So I don't know if I made that more confusing, but I think they marry each other really well. I think health coaching is the communication and accountability, where health education is sort of the knowledge and foundational component.
Now, I think with your role, what's kind of unique is that you're one of the, a handful of health educators that are in, primary care settings or in like a medical clinic setting. And you said you were kind of fortunate based on where you were located to be able to get into it. Yeah. What do you have to say for people that are coming into the field or wanting to work in a medical practice, number one, and getting used to the CPT codes and like the reimbursements that you've gotten from doing those services? Can you talk a little bit about it so it can give them an idea? Let's say somebody has an intention of partnering with a physician or a health system, or they're already working in those settings, but I'm not doing any of these. I'm just like, wow, we can actually do this and get money for them. Can you talk about the CPT codes a little bit?
So I actually had someone who had read the article several years ago contact me. She was in North Carolina, which was convenient. And so we've had a couple site visits, and she read the article and she says, I want to do this. And so she says, I have a friend who's a physician at an internal medicine group. I'm going to go talk to him. And that's what she did. She went and talked to him. She showed him the article and she created a job for herself. And so using those connections and kind of backing it, and mine is not the only article now. I mean, it's cited and used in other articles now. Also, Dr. Thomas Bodenheimer out of UC San Francisco has a whole model around health coaching. I mean, just read his stuff. He has published tons and tons of stuff about the efficacy of health coaching. So take that information, go to administrators, go to physicians if you have that opportunity, and try to create that position. What they want to know is how you're going to pay for yourself. Well, you have that now. I mean, it's printed and established. So things that I was lacking when I got in that job was a lack of medical terminology. I had never taken a medical terminology course before, and so that was a big wake up. So I would take medical terminology, and then also CPT and billing coding. Now it's pretty dry. You have to be really interested in that, but understanding how people are paid in the medical world is really advantageous for you, because you can deep dive and it's all kind of a game, and get the most points and get billed for it, and when does it get denied. And so understanding billing and CPT codes, which I'll talk about in a second, is something that I wish I had. And we're at home with COVID, so I have children going back and forth. At least they're not trying to talk to me right now. So so a CPT code is short for I always get this name wrong. It's it's procedural code. It's
current procedural terminology.
See, I had it in my brain, and now it's not there. And I don't want to move on until I have it.
No worries.
Stands for, everyone just calls them CPTs now, so it's not like it's written anywhere. Something procedural code.
Yes, current procedural.
Current procedural code. Thank you. I could not. There are 3 levels of this, right? So there's a level 1, a level 2, and a level 3. Level 1 is the ones that are enacted, they're enforced, they're currently used. A basic, office visit is a 99214 or 212, 213, and 214. And so, and that's probably a foreign language to you right now. It was to me when I first started, but they're the known codes. They've been tried and tested. You bill for them, you get paid for them, as long as you have the documentation to support it. CPT 2 codes are for reporting measures and chart reviews and abstracts. And so, and this is why physicians really complain about all this, is not only are you having to bill for the actual services you do, but you also have to drop what they call codes or billing codes, excuse me, to track your progress. Are you doing a foot exam? Because you may not get paid for that foot exam, but you have to put a code to say that you've done a foot exam, excuse me. And so the CPT 2 codes are really for outcome measurement and tracking of quality, which me as a public health person, I love those. But it's a pain in the butt when you're having to remember so many different codes and while you're billing and seeing patients. The 3rd level is called is used for what they call emerging technology or capacities, procedures, or service. So it's emerging. Oh my gosh. And thankfully, back in 2019, I had the opportunity to work with Linda Lysobi, who is the president of NCHEC. And she had known my work, and we had got to know each other. And she was going with some other leaders from health coaching to talk to CMS, Centers for Medicare Services, to say, hey, we're doing work, we're in these settings, how can we track what we're doing and get paid for what we're doing? And so she met with the folks up in DC a couple of times, and they were awarded CPT 3 status for health coaching. I'm going to show you, it's kind of small, but I'm going to try to share a screen again. We were given a couple CPT 3 codes that we can use to track our work. So it's right here, 0591T. So if you drop that code, you did health and well-being coaching face-to-face and individual during an initial assessment. So as you can see, we were, as of July 1st, 2019, allowed to start using these codes. Goes on 0592T. And then there's these rules. If you don't know about billing and coding, you can't report this if you're doing that. And so taking the time again to read these is helpful. And then also the 593T. And so we can use these codes now to kind of mark what we're doing or not. This is helpful. So even though we don't get paid for these codes, this is helpful because it starts demonstrating with CMS that we're in these settings and that there in fact needs to be a way to capture our services, right? what other questions about CPT might you have?
No, so like when you do your services at the clinic, how do you track them? Is it with a particular software? Do you generate a report on a daily basis, weekly basis, monthly
Yeah.
basis?
So the great thing about a code is that it's discrete. You can't change it and you can find it. So part of my role was learning how to run reports out of what we were using as Epic, electronic medical record. There's hundreds of them out there, but I learned how to run reports based on that number. So a 99 G0. Oh, now you're quizzing me. It's been a minute. G0439 is a Medicare subsequent annual wellness visit code. And so I would run a report based on that G code. And so I can see how many visits I did, how many times it was paid out or was denied or things like that. So typically EHRs, you can run those reports. I mean, especially if it has anything to do with money, they've got those reports built. They want to see who's doing what. So if I started dropping these new codes, I would just then later on the back end look and see. CMS is collecting all that data based on claims.
Okay, based on the claims that people are submitting.
They're not paying out for them, but they are collecting it.
I see. Okay. Yeah, it's great because I was talking to another health educator, and we were talking about the codes that health educators can build for and track. And then in one of the sessions that we had with Miss Margaret Moore, she talked about, just having that data and being able to keep it, because that's what's going to drive the field forward. That's what's going to put the dollar amounts into to the services that we're actually providing.
Well, that's exactly right. I mean, if we aren't using those codes, it's evaluated for 5 years. CMS gives us a 5-year time period to use them. And however they're used, they'll be evaluated. Do we move it up? Does it need to be repaid or paid for, reimbursed? Is it something that's just not utilized and we're going to drop it? Because the book is thick, right? And so they have to take out stuff that's not being used on a regular basis. And in fact, NCHEC just put out a call. Well, last May they put out a call for anyone who may be using these codes to please contact them. There is a website. Again, I'll show that to you, and I can share that link with you afterwards, where they talk about this and they say, hey, any health educators out there, please start capturing or using these codes. I think it really was a call to say, we want to make sure it doesn't get dropped. And so after all that work they did, can you see my screen now? No?
Yes, I can.
This was the article they put out in May, CPT code for health and well-being coaches. And so what they're saying is, if you're using it, please contact them. If you're currently employed, they want to report back and track the use of these codes. And if you're interested, you can collaborate with the group and go to DC to continue that conversation to move it forward, just like you were saying.
Okay. Yeah, that's a good opportunity to know that people can reach out to NCHEC and say, hey, I'm doing this in my practice. And then, I've talked to some health educators who aren't even aware of the movement that's currently happening with the health coaching and doing all the stuff. And then people are always in that phase of wanting to expand their scope of practice or do a little bit more with what they have. And like, well, you have a JAS certification or credential, it can open up a lot of doors for you. Now, one thing I had talked about when you were talking about the annual wellness visits, have you seen people doing them virtually? Because I know with COVID-19, a lot of stuff shifted from person to virtual care, and that was also one of the things that could be done virtually.
Sure. Yeah. So a lot of medical visits were moved to a telehealth remote kind of situation. Yes, annual wellness visits are being done remotely. I think it's kind of ideal if the patient actually has like a scale or stuff, just so they can self-report some of their vitals, because obviously you wouldn't be able to do their vitals. But 90% of the annual wellness visit can be done through a telephone or, through like the cameras. to discuss sort of their status. It also gives you, and providers talk about this all the time, it gives you a peek into their home life, right? So you normally see them in the clinical setting. Well, now you're seeing what's happening behind them, or you can say, hey, open up your cupboard, take the camera and show me what's going on. And so there are some opportunities with that that we didn't have previously to telemedicine. It's also really a great opportunity to try or use remote patient monitoring equipment. So if you're able to tap into that or get some of that remote patient monitoring equipment, such as scales or blood pressure graphs, or sometimes they have heart monitor stuff, it's great to incorporate that into an annual wellness visit. And I'm currently working on a project with remote patient monitoring equipment and trying to see if we can, if it actually helps improve some of our rural health communities by handing those things out and then following up remotely.
Now, one of the things that we talk about in the certificate program, one of the CE activities that we have on health coaching is for health coaches to realize their scope or their boundaries. Like, you're not diagnosing, you're not treating, you're just looking at the information. You know, a patient comes to you because they have diabetes or high blood pressure or obesity, and you're doing like the lifestyle sort of helping them manage. You're not saying, I'm going to change your medicine, I'm going to prescribe you this, and this. So
yeah, so that's one of the biggest risks that a provider takes on by bringing a health coach in is, does that health coach have the decision-making abilities to know when to escalate something or not, right? So being really mature about that you're not going outside of your scope of practice. We do a lot of screening stuff during the wellness visit, such as the dementia test and things like that. And we don't say you have dementia at the end of it, right? What we do is, it looks like you have this score. I'm going to schedule a follow-up visit with your provider. And then notify the provider that they've had this result and they need to have a conversation around that, you know, at their next appointment. And so we do not diagnose, we do not treat. We basically assess and review things, and then hand it off to your care team. You know, hand it off to other people within your care team. Which again, as I mentioned earlier, is kind of a relief it was a relief for me, because when they talked about that knee pain, I wasn't trying to diagnose that knee pain. I wasn't trying to figure out what was causing that knee pain. I noted it and I made an appointment, right? I don't have to fix the diabetes today. I can share with them best practices and set goals with them, but I'm not worried about titrating whatever, their insulin or anything, right? You know, if their readings are out of control, like their blood sugar readings are high, I then schedule that appointment and say, doctor, these blood sugars are really high. There was one example. I had a man come in to do an annual wellness visit, and I would do foot exams as part of the exam or wellness visit. But that's not necessarily a requirement, but I was doing them because it helped close some of the care gaps. And I pulled off his shoes, and he had a sore, and he said he had. And so I was like, well, home with this sore, you know, he's diabetic, he doesn't necessarily feel it. So I went and found a physician. I said, okay, I'm doing a wellness visit, but I think this needs to be at least looked at, right? Because I didn't want to let out. But did I tell him there was a problem? Did I treat it? No, I went and got somebody and had him look at the foot. It turned out to be fine, and he was able to go home. But really understanding your role and not going out of that role will help further you within your care team, because we all are kind of protective about what we do, right? Yeah. You need to fit in, not take over.
I really appreciate your time. I have one more question for you. So in your scope of practice, have you taking a liability insurance or malpractice insurance? Is there questions I've seen posts on like social media, like, I just got this job as a health coach. Should I get an insurance to cover me in case somebody tries to sue me?
If I was an individual health coach that kind of just put a shingle up and is out there, I would have some sort of, I'm not a lawyer, I don't know the legality of it, but I would personally get some sort of liability. In the setting I was working within a clinic that had its own insurance, and I was technically working under the physician's license. So the physician's license and liability covered me. And again, that's something that could be a barrier to provider having you come, is because he's ultimately taking responsibility for anything you may do. So really being confident and being able to express that, know when your scope of practice, know when to escalate, is really important to that physician or important to that clinic because you're working under their license.
And for the annual wellness visits, I know it's specific or to Medicare. I've seen some private insurances, or different models try to do something similar. Is that something that you guys have done for private insurers or sort of private under the Medicare Advantage type of plans?
So yes, Medicare Advantage, they pay for the wellness visits. So a 40-year-old man who has, let's just say, a Blue Cross Blue Shield product, he's insured through his work. They do not pay for what they call an annual wellness visit. They pay for a physical, and that has to be performed by a provider. The way we sort of played with this, and this is again in the article, is creating, how do I best explain this? So Joe's 40-year visit with his doctor. A doctor typically sees, let's say, 10 people in a half day. So he's billing for 10 office visits within that half day. But Joe is fairly well controlled. He just needs some behavior modifications. Like he doesn't need medical, medication assisted intervention or anything, but he needs some support around his diabetes management. So that day, the doctor, instead of 10 visits in the morning, he would have 11 visits, which looking at his schedule is just too much. He can't see 11 patients in a half day. But really, Joe's seeing me for 30 minutes. And we're going over the behavior management, we're going over the goal setting, all that stuff. And then the doctor sort of pops his head in, lays his hands on him, spends about 2-3 minutes, and then together we co-document that visit, which in the medical world you have, depending on how complex that visit is, you have a level 1, 2, 3, 4, or 5, which you can bill for, and the higher the level, the more money. So I come in and address his diabetes and maybe his smoking. We document that together and we bill that as a level 3 office visit. So instead of, let's say he makes $100 a visit, $1,000 for that morning, he just now made $1,100 because we technically had 11 visits. So I still couldn't bill for me. I wasn't billing for Suzanne services. I was billing for the physician services, but we were co-doing that appointment. And so thereby creating more revenue. Does that clear? Yeah. And the article kind of explains that a little bit. Yeah. That is a tricky way to do it just because of scheduling. It's kind of hard to move and schedule and have the provider in a couple places, but it worked. We were paid for it. There were never auditings. I think it was great care. And then after that, I follow up with the provider. I follow up with the patient telephonically. So, hey, Joe, yeah, we talked last week, how are these goals going? And I didn't necessarily get paid for that time either. However, there are that's starting to change. You can bill for non-face-to-face patient activities. I don't have those codes right off the top of my head, but work you do for the patient without the patient, it can now be billed in certain ways. You're shaking your head. You know about those?
Yeah, because with the this is completely different, but like with the chronic care management and non-physician providers being able to do that, it's something at least the pharmacist or the nurse practitioners are able to come in and help the doctors do.
Right, and you can bill for that time now, whereas 10 years ago that didn't exist. So the call to action, other than using the CPT codes and letting NCHEC know about it, is, gosh, if there's someone out there who just really loves billing and coding, take a deep dive and start finding all these kind of caveats and then publish it, because gosh, we're waiting for it, and we need to know the how. We understand the why. We know it can help. How do we do it financially? Is what we need, and we need someone to really do that deep diving to find that information out.
Well, that's a great note to end on. Thank you, Miss Lineberry, for being with us this morning. And it was quite a lot that we unpacked in this session, and I'm pretty sure the audience is happy with the content that you shared. And,
sure.
The article again is adding health education specialists to your practice. If anyone is interested in checking it out, it is a great resource for our time in this, as we move the profession forward and as we advance health coaching. So I want to thank you again for being with us and being part of this summit.
Great, thank you.
Thank you. Well, hello. Thank you all for tuning in. I know it's been quite an evening. I apologize if I took up a lot of your time, but it was great information that I just had to share with you guys. I promise I will not keep you this long tomorrow. It's a much shorter event, but this is our first day and the first time we're kicking it off. So we just had some great information to share. We've all heard from Coach Meg, Margaret Moore. We call her in the coaching world Coach Meg, and she just kicked us off with the history of health coaching and the CPTs and what they've been doing to advance the profession of health coaching. And then we followed up with Zikea Moore and her energy about board certification in health coaching and the tips that she shared about wellness, working in corporate health and wellness and getting started. And finally, we finished up with Suzanne Lineberry, and who is a chess, and most of us in this audience are chess individuals. I apologize. Suzanne is an M-Chess, Master Certified Chess. And for the health educators in the room, I think what she's doing is a good inspiration and a good guide and direction for people who want to get into health coaching. So I hope you enjoyed today's sessions. If you have friends, if you have coworkers, send them information about these sessions. You can watch them on your own time. Again, they are available for 4 hours of CE credits, totally free for anyone who wants to take advantage of them. There are paid levels with the summit if people want other benefits that come with the summit. We have a great session lined up for you tomorrow. You can certainly check out the agenda on the registration page. I guarantee you're not going to be disappointed. Thank you again for tuning in. And if you have any questions or comments or feedback, feel free to drop them in the comment section on the registration page or send me an email. Again, drive your friends, send the emails, let them know that this is going on so they can tune in and get CEs if they so want as well. Thank you again for tuning in and have a good night. And before we close, I apologize, I have a bonus session for you guys coming up shortly, just so you can unwind and enjoy the rest of the evening. It is a meditation session by one of the sponsors of this summit, Miss Betty McGuire from the Health Coach Clinic. And hopefully you enjoy it and just kind of relax and unwind for the rest of the evening. Have a good night.
Hello and welcome to this relaxation video. My name is Betty McGuire and I am a registered yoga instructor and a health and wellness coach. Today we'll start with some movements to help move tension out of the body, and then we'll finish our practice with relaxation practice lying down. What you'll need today is a yoga mat or blanket on the ground beneath you. So you can't see mine, but I'm standing on a yoga mat that's spread out here, and I have a blanket sort of on top of it just for extra cushion and comfort. I also have another blanket to go on top of me when I'm lying down for the relaxation practice. You might like a pillow to place under your head, and any other pillows or cushions that you might have to put under your seat or to support your knees or any other part of the body when lying down on the ground. We will begin the practice first by checking in to see if there's anything that we need. Do you need to use the restroom? Do you need to get a glass of water? Are there any movements that you might want to take on your own? Just listening to the body to see what's coming up for you right now and see if you can tend to those needs that are coming up. So if you'd like, you can even pause the video and go take care of something that might need to be addressed and then come back. So we'll begin in mountain pose when you're ready. Bring the feet about hip distance apart. You can just look down and sense and feel the feet are in a comfortable position. If you're really not sure, you can take your two fists, put them in between the big toes, and then from there, press the feet into the ground and allow the body to rise up from the space. We'll inhale the shoulders up to the ears, squeeze and hold. And then exhale, drop the shoulders down. We'll do this again, and on the exhale, really let the air escape from the mouth with as much energy as feels like it's there. So we'll inhale, squeeze and hold, and then we'll exhale, release. So we'll do this one more time. Inhale, shoulders to ears, squeeze and hold. And then exhale, drop the shoulders down, release. We can widen our stance just a little bit here. And inhale, the hands will come up overhead, reach up, stretch up. And exhale, the arms float down alongside you. We'll do this again. Inhale, hands up overhead, reach up, stretch up. And exhale, release the hands, the arms float down. And if you'd like, you can bring a slight micro bend to the knees. We'll do this movement again. Inhale, hands come up, reach up, stretch out. And then exhale, release the arms, float down alongside the body. Do this 2 more times on your own breath. Breathing in, breathing out, and syncing movement with breath. When you finish, we'll meet back in a neutral position. Feel that the body is resting, even though we're standing in this position here. See if there are spaces in the body that you can rest into. Let the belly be soft. On the next inhale, we'll bring the shoulders to ears, squeeze and hold. And exhale, drop the shoulders down. We'll shake out the hands one way, shaking out the wrists and the fingers, as though the tension could fall out of the tips of the fingers with every shake. So we'll shake. And then the other. Now let the hands come to rest alongside the body and begin to rock the arms back and forth. So just swinging from the shoulders here, the arms are rocking back and forth. Back to a simpler time we'll go in our minds, whoops, when there was nothing to do and nowhere to go. Think back to a time in your life. It might have been childhood even. Just this carefree time. Nowhere to go, nothing to do. Just swinging our arms. You might even have a little rock in the hips as you do this. Nothing serious going on here. We're just being in the moment. We're being here now. And there might be things to do later today. Right now, this is what we're doing. Having nothing to do, right? And we'll let the arms now cross in front. So as you casually swing the arms, let them cross in front of you and alternate back and forth. So right over left, left over right. And you can play with the speed. You can slow it down. You can play with the height. Okay, swing the arms up high if you want, or down low. And even how far along the arm you're going to let them intersect. So maybe down at the wrists, or might feel better to let them cross up at the elbows. So it's up to you, listening to the body, noticing what's juicy for those shoulder blades. What kind of movement's going to feel real good and help release some tension from the body. Always awareness with the breath as you move. Let this slow down until you work your way into stillness. We'll just pause here for a moment. You might let the gaze soften, or you might close the eyes completely. A softened gaze is letting the eyelids kind of rest so that they're not completely open, and settling them down to about a 45-degree angle so that you're gazing at a fixed point on the ground in front of you. So that's another option you can take when the instruction is to close the eyes. So as we stand here, we feel and sense into the body, notice any changes, notice anything that's coming up for you right now. Being present and aware and meeting whatever's coming up with our full attention and our awareness. Extending self-love and self-compassion when needed. When you feel ready to move on, let your awareness move to the breath. And we'll make our way down to the ground for the next part of our practice. So if you're on a yoga mat, you can make your way down to the yoga mat. Or if you have a blanket beneath you, you can go ahead and use that. As we continue, I'm going to be lying down on the mat and talking you through the relaxation practice. I'll put a pillow under my head and a cushion under my knees to support my low back. I invite you to do the same. The more comfortable you can be during this practice, the more you can induce relaxation and enjoy the benefits of a relaxation technique. So do all you can to make yourself as cozy as possible, and you'll know that the relaxation practice is finished by the sound of the bell. I'll also cue you up into a seated position, but just to let you know what to expect. Be lying down, and then we'll be sitting up at some point, and I'll be ringing this bell for you, okay? When lying down, make sure you take the time to make any micro adjustments that you might need to be as comfortable as you can. Let the heels fall in, the toes fall out. You can lie on the belly if you want, or lie on your side. However you are, make your way into a position that you can stay still for several minutes. Today, for this progressive relaxation practice, We'll start at the top of the head. So first, bring your awareness to the space just above the top of the head. Let your awareness rest here for a moment. Notice any areas of holding or tension in the space just above the top of the head. And give the body permission to let go and drop down into the earth beneath you. We'll now move to the muscles of the scalp, the back of the head, and the neck. Bring awareness to these muscle groups, to the skin and the bone. And let these spaces of your body be filled with awareness. As you notice areas of tension, and let go, dropping down into the earth beneath you. Continue to guide the awareness through the body into the muscles of the face and the front of the neck. The space between the eyebrows. Invite it to rest. Invite the cheeks to rest, the jaw to rest, and the tongue to rest. Let go of tension in the face and the front of the neck. And allow this tension to drop down beneath you. Continue moving awareness through the body into the right shoulder and the right upper back. Notice any areas of holding or tension. Instruct the body to let go. Continue moving this awareness through the right arm, down into the right elbow, the right forearm, and the right hand. Give the right hand permission to rest and relax. Palm of the hand, the back side of the hand, and all 5 fingers on the right side. One at a time. Guide the awareness back up the right arm and into the chest, moving over to the left shoulder and the left upper back. We notice areas of holding or tension on the left side of the shoulder. Continue moving down the left arm, the left elbow, and the left forearm. Let the left arm rest and relax. Awareness moves into the left hand, the palm of the hand, the back side of the hand, and all 5 fingers on the left side. With the awareness, move through each finger one at a time, inviting the muscle tissue to rest. And let go of any tension that may be lingering there. And now move the awareness back up the left arm toward the center of the chest. Begin to use the awareness to scan the back side of the torso, from the shoulder blades down to the tailbone. Notice any areas of holding or tension, and give the body permission to let go of this tension. Drop down into the earth beneath you. And now allow the awareness to move from the back of the torso upward, becoming aware of the inside of the spine. So we might have had an awareness of the outer side of the spine, facing toward the back of the body. Now the awareness comes to the inner side of the spine, facing toward the rest of our body, right? Front side of the body. Become aware of the skeletal system that contains our organs and also keeps us upright and standing through the day. As you become aware of the skeletal system, continue to notice any areas of within the rib cage, within all of the muscle tissue that's holding the torso together. We become aware of the heart. We become aware of the stomach. We become aware of the lungs. And we invite all of these parts of ourselves, the organs, the muscles, the skin, even the bones. All of the blood and veins, everything that makes us up. And invite all of these parts to rest, relax, recover. Continue moving down the body with the awareness into the hips. Invite the back side of the hips to rest and relax. Continue scanning the body for any areas of holding or tension in the pelvic region. Notice the sex organs. Invite rest and relaxation into these spaces of the body as well. Letting go of any holding or tension that is unnecessary. Again, becoming aware of the skeletal system. And its need for softness and rest and recovery as well. Allowing the joints to decompress as we lie here, inducing relaxation. Continue moving awareness down the right side of the body, the right upper leg, the right knee, and the right lower leg, instructing the body to let go any tension in the right leg. Let the awareness move into the right foot, the top of the foot, the bottom of the foot, and all 5 toes on the right side. Move the awareness back up the right leg toward the center of the pelvis, and then down the left leg. Noticing the upper leg, the knee, and the lower leg. Sensing for any tension or holding, and then inviting the body to let go of that tension. Continue this process into the left foot, the upper foot, and the lower foot. And then all 5 toes on the left side. And we'll feel that the whole lower half of the body is now also relaxed and resting. On the next exhale, draw the awareness from the bottom of the feet up to the tip top of the head. And on the exhale, let the awareness move with the breath from the top of the head down to the tips of the feet. Continue to breathe this way for another 3 to 5 breaths, letting the awareness move up and down the body with every inhale and exhale. Try not to focus too much on the direction of the breath and whether it's linking with the direction of the awareness and whether it's linking with the breath up and down the body. What's most important is that your awareness is moving through the body and that it is somehow connected with each inhale and each exhale. As you begin to return to a normal breathing pattern, you can slowly start waking up the body by rolling the wrists and rolling the ankles. You might squeeze the fingers and toes into a ball and then release, open them up. Continue to breathe and move. Let the eyes flutter open. And we'll bend the knees and turn to one side if you're not already lying in the fetal position. We'll just turn to one side, and if you'd like, you can use the hands to rest under your head. Support your head a little bit more. We'll take one breath here together. So inhale big and then exhale out of the mouth. We'll do it together here. Big inhale. Exhale. Now we'll slowly make our way up into a seated position. Put the cushion under your seat. And bring the hands to rest on the legs. So you could be seated in a chair, or you might be on a cushion like I am here. However you are, let the hands rest. And lower the gaze to a 45-degree angle. And let the ears follow the tones of the bell. You bring the hands to heart center in prayer position, or if you'd like, you can rest them palm over the heart space. You can lower our heads in gratitude for this practice today. And please take this time to thank yourself for taking a moment to rest and let the body recover from all of the hard work that it's doing to keep you upright and mentally sharp throughout the day. All right, that concludes our practice today. Namaste. Hope you have a wonderful rest of your conference, and thank you for joining me. Peace and take good care.